Thank you for giving me the opportunity to introduce our research. Our study focuses on the clinical and imaging characteristics of SARS-CoV-2 breakthrough infections in hospitalized immunocompromised patients. This is the introduction of our study. Vaccination is the most effective way to prevent serious outcomes and death from SARS-CoV-2 infection. However, immune response to vaccination may be blunted in immunocompromised patients, and thus they may be at increased risk of severe illness regardless of vaccination status. Although each of immunocompromised conditions is related to more severe COVID-19 outcomes, it is important to note that the severity of outcomes varies substantially within each condition. So this study aimed to evaluate the clinical and imaging characteristics of immunocompromised patients hospitalized for SARS-CoV-2 breakthrough infections and compare them with those of immunocompetent patients. This is multi-center retrospective cohort study from two academic medical centers registered in the Korean Imaging Cohort of COVID-19 database. Patients with SARS-CoV-2 infection with a record of receiving at least one dose of SARS-CoV-2 vaccine between June 2021 and December 2022 were included. Patients hospitalized for COVID-19 were eligible for analysis, whereas those diagnosed with COVID-19 during hospitalization for other medical conditions or whose clinical records are missing were excluded. Immunocompromised status was defined as active solid organ cancer, active hematological cancer, active immune-mediated inflammatory disorders, AIDS, or status post-organ transplantation. The detailed definitions of immunocompromised status are shown here. Various clinical factors and outcomes were evaluated through electronic medical records. We define patients with severe clinical outcomes as those with any of the following, such as in-hospital deaths, requirement of ICU admission, or requirement of mechanical ventilation. Chest radiographs were available for all 2,218 patients with CT scans available for 711 patients. All images were independently reviewed by two thoracic radiologists using a modified 3-point visual scoring system based on a percentage of annual opacification. This is results of our study. Of the 2,218 patients included, 274 were categorized into the immunocompromised group, and 1,944 were categorized into the immunocompetent group. The immunocompromised group was subdivided into 5 subtypes: active solid organ cancer, status post-solid organ transplantation, active hematological cancer, active IMID, and AIDS. The mean age of the entire patient age was 69 years, and among them, 50% were male. In the multivariable analysis, the adjusted ORs for severe clinical outcomes were significantly higher in the active solid organ cancer subgroup and the status post-solid organ transplantation subgroup. The adjusted ORs for severe pneumonia was significantly higher in the status post-solid organ transplantation subgroup and the active hematologic cancer subgroup than in the immunocompetent group. Immunosuppressants, which are used to prevent transplanted organ rejection, contribute to a poor vaccine response by reducing both cellular and humoral immunity. Our study revealed that status post-solid organ transplantation had the highest increased risks of severe clinical outcome, severe pneumonia, and typical COVID-19 pneumonia compared to immunocompetent patients. Severe lung injuries manifesting as organizing pneumonia or diffuse alveolar damage patterns correlate strongly with severe clinical outcomes in solid organ recipients. Our study has several limitations. First, the number of patients with various immunocompromised conditions, particularly those related to the type and duration of immunosuppressive medications and specific immunosuppressing factors, was insufficient to allow robust comparisons of breakthrough infection severities across various categories of immunocompromised data. Second, selection bias is possible because the study was performed on hospitalized patients, and this may have increased the portion of immunocompromised patients in the cohort. Lastly, due to the retrospective design of our study and the ongoing emergence of new variants, it is challenging to accurately reflect data based on the current variant of concern. So this is conclusion of our study. Immunocompromised patients with a COVID-19 breakthrough infection overall showed increased risks for severe clinical outcomes. Severe pneumonia based on chest radiographs and typical CT pneumonia. In particular, patient status post-solid organ transplantation were specifically found to be at higher risks of all these three outcomes compared with hospitalized immunocompetent patients. Thank you for your attention.